Welcome to A Stride Above podcast, where our commitment to excellence in equine health and athletic performance unites us. Join your host, Dr. Alberto Rullan, as we trot through the essential topics that matter most to you and your equine family members. With over 15 years of experience in equine sports medicine and rehabilitation, Dr. Rullan is dedicated to navigating you through the latest innovations and essential insights in horse health. Together, we'll ensure that you and your horses always remain a stride above the rest.
Hello and welcome to another episode of A Stride Above. Today, I have Dr. Colton Ramstrom as my guest, and we're going to talk about some interesting topic. Thank you very much for being here with us.
Thank you for having me.
I wanted to bring someone else and talk to you about arthritis. You know, arthritis is the most common cause of lameness in the horse. No questions about it. It actually is estimated to be estimated losses in the equine industry, probably of several hundred millions to billions, right?
Yeah.
So, doctor, can you tell me a little bit about your experience with arthritis? And can you explain, because you're so good at explaining, can you just, with this model, explain us what is arthritis?
Sure. I guess we could start with some basic definitions. So let's look at the word arthritis. Arth, it just means joint. Itis just means inflammation. So arthritis, inflammation of the joint. So here we have some bones from the lower leg of a horse. The pedal bone, short pastern, long pastern, navicular bone tucked back here. And arthritis will develop whenever there's any injury or instability to that joint. It could be something developmental. It can be soft tissue injury, such as a supportive collateral ligament injury, a joint capsule injury. Any injury to the joint that results in inflammation can result in arthritis. So using this just as an example, say we had a injury to a collateral ligament of the pastern here, so the pastern joint, then you could get secondary arthritis, inflammation of that joint. What you might see is periarticular osteophytes, or what we like to call bone spurs, form here. So there's a level of instability that develops with the injury to the collateral ligament. The bone really only knows one thing to do there, and that's to produce more bony tissue to try to stabilize that instability that's resulted from that soft tissue injury. And along with the bony changes, the inflammation, you get things like pain, decreased range of motion, joint capsule stiffness, tightness, inflammation, swelling, all of those things.
That was probably the best explanation of arthritis I've ever seen. Thank you very much. So to the molecular level, let's go deep into the granular space of the joint. What is in the joint? And a lot of the questions I get constantly, hey, what supplements can I do for arthritis? And I don't want you to go into what supplements specifically, but what's in those supplements and why? Absolutely.
Yeah. So a lot of the supplements that we commonly see in the equine industry have things like chondroitin, glycosaminoglycans, all of these molecules that are intended to promote joint fluid health, promote cartilage health, and promote synoviocyte health. So the synoviocytes are the cells that are actually responsible for producing the joint fluid, the synovial fluid, and that's what's responsible for getting nutrients to the cartilage and maintaining cartilage health. So all of these things are targeted at trying to maintain the health of those kind of three main joint components.
Now, tell me, let's go now a little bit more into, without giving a lot of marketing to the joint supplements out there. Give me your thoughts on oral supplements for arthritis versus injectable supplement for arthritis versus directly in the joint.
Great question. This is probably something that we get asked daily by clients. Data on feed-through or oral joint supplementation is limited in horses. There's not a lot of agreement on a lot of the studies that are out there.
That's a polite way to say they suck. Huh?
Yeah, or okay. limited effect. Right. Yes, that's typically what I say. They're unlikely to hurt the horse, and they might help it if that's where you want to spend your money. Okay. But yeah, there are a lot of other great ways to help promote joint health, treat inflammation in the joints. I think the most effective ways would either be direct intra-articular treatment, so that'd be joint injections, or injectable chondroprotectants, things like Adequan, Legend, polyglycan, these things that actually do have better data. They don't have to go through the digestive system where they're significantly altered. And we actually do see increases in joint health markers and decreases in markers of inflammation when we treat horses with these products.
Now, that's if we put them in the muscle or the vein.
Yes.
Can we put them directly in the joint?
Absolutely. Depending on the product. I wouldn't go and stick Adequan or Legend or those things directly in the joint, but when it comes to direct intra-articular therapy or joint injection therapy, we have how many different excellent products that we can use. There's a plethora of them.
Very good. Well, that's a very very concise, extremely well explanation of arthritis. Now, do you remember? Maybe you don't. Back in the days, we used to do a lot of Equine joint. Then a paper came and they had some infections. So for whatever reason, we start moving away from injecting Equine in the joint. But there's still people that still do it. Actually, when I analyzed that paper a little bit, I noticed that they were not using antimicrobials. Now, that's going to get into a big controversy, which we can talk later in another episode of our podcast, whether we do antimicrobials or not in the joint injections. But I just wanted to say that because back in the days, we used to put a lot of Adequan in joints, and we kind of have moved away from that a little bit. Then all the products like that I think we used to do Legend as well. And this is not more than 5-7 years ago, and the industry has evolved quite a bit, obviously, where we have other products that we prefer. So these products were used, and I don't know if many papers proving the efficacy of them. There were some, right?
Yeah, I believe so.
But we have quite a bit of products right now. We recently did a study, a product called Pentosan. And we found out that it improved the lameness grade about 1 degree if you do it in the muscle. Now, my problem with that is that if you have a horse that's 3 out of 5 and it becomes 2 out of 5, is that horse ready for competition? No, right? So my question to you is, what do you recommend your clients to do when they say, okay, I want to do supplements? What is your recommendation if the horse has arthritis as well? Do you go with both the intramuscular plus joint injections as well? And how do you manage that?
That's an excellent question. Yeah, in short, almost every time, yes, I recommend directly treating with some sort of intra-articular joint injection therapy, as well as putting them on a systemic injectable product as well, like Pentosan or Adequan or those things that you're mentioning. Yeah, and that paper that was recently done on Pentosan, it's like you said, we're improving horses, but we're not necessarily getting them to the point that we want, where we have client satisfaction, where we have full comfort and performance from the horse. So yeah, that alone is not going to be a standalone treatment, but it's absolutely should be part of our treatment protocol.
Excellent. Thank you very much, Dr. Colton. Amanda is giving me the look that we probably should start wrapping it up. So stay tuned. Let's do another one. Let's do another episode on arthritis to help add value to our clients. I hope we added some value to you, to your knowledge, to your horse. If you like our conversations, don't forget to like us, to share us, give us a review. If you do not like it, just tell me and I'll change it, okay? All right? So I hope you have a great day. Thank you very much. Stay tuned. We're going to do some more.
Thank you.